Now, what are the symptoms of the cervical cancer? How the woman is coming to us. She can come to us with the pain in abdomen, with the backache, with the intermenstrual bleeding. That means the woman is coming to us and saying that she lost her menstrual patterns. That means the menses is not regular, or there is a heavy bleeding during the time of menses, or there is a continuous bleeding for last 5 to 6 months. That means what I wish to emphasize is any irregularity in the menstrual pattern should be addressed by the doctor and not by the mother-in-law, not by the padosis, not by anyone. Please go to the doctor when there is an irregularity or when there is an altered menstrual cycle. Please consult the doctor. The doctor will examine you. Gynecological examination is must for these patients, and after gynecological examination the doctor can take the pap smear. The doctor can see what is the condition of the cervix, what is the condition of the uterus, and the doctor can advise the investigations accordingly. So any alteration in the menstrual pattern should be addressed by the doctor and not by anyone else. Secondly, the women can also present with the postcoital bleeding. The postcoital bleeding is a very ominous sign. It is a sign that women can suffer from something suspicious, something like a cancer. So the postcoital bleeding, whenever the woman is coming to us in our OPD with a symptom of the postcoital bleeding, it gives us an alarming sign that she can be a case of the CA cervix. Now, she can present with the pain in abdomen, and the very common presentation of our country is discharge PV. That means there is an discharge PV, and sometimes it is the foul smelling discharge, sometimes it is the continuous discharge, sometimes the discharge is associated with the rashes, with a lot of the smell, right? So any discharge per vagina is abnormal. Leukorrhea is something else. Leukorrhea is normal but excessive vaginal discharge. Leukorrhea is normal but excessive. But discharge that is associated with the smell, that is associated with the rash, that is copious, that is yellowish in color, or that is blood mixed, should always be addressed by a doctor. So discharge per vagina is never normal. If the discharge is copious, that is the women has to use pads, the women has to use the sanitary pads, then it should be addressed by the doctor. Or there is a change in the color of the discharge, that is it is yellow, it is blood mixed, it is foul smelling, it is associated with the rashes, it is copious, then it should be addressed by a doctor. Right. The third symptom is the pain in abdomen. The women complain of there is a lot of the pain in abdomen. The pain in the lower abdomen is not a good sign. It can be associated with the congestion. It can be associated with the CA cervix. It can be associated with the chronic pelvic inflammatory diseases. So whenever there is a constant pain in abdomen and there is no history of the constipation, no history of difficulty in passing urine, no problem elsewhere, then this pain in lower abdomen is most commonly related to the pelvic congestion and it should be addressed. Fourthly, there can be backache. Sometimes the women complain of a constant backache. So backache is never a good sign. Backache means that cancer can be in the advanced stages, and when it infiltrates the normal structure, when it comes out of the uterus and the cervix, it infiltrates, that means bahar ki taraf aa gaya hai, so it can be associated with the backache. So the constant backache, the prolonged backache should be treated by the doctor, should be shown to a doctor, to a gynecologist, where she can do a normal gynae examination.